FluMist, the only nasal spray flu vaccine administered at home. Ordering FluMist. First, go to FluMist.com and click Order Now. Complete the eligibility screener by providing important medical history to make sure FluMist is right for you and everyone you're ordering for. Make sure you've got your insurance card and payment info ready. Then just choose your delivery date. A healthcare provider will review the medical information you provided to make sure FluMist is right for everyone in your order. Then FluMist is shipped directly to you. FluMist delivery, unpacking, and storage. Your FluMist package is here. Your FluMist Home package contains the unpacking directions, sprayer return materials, the cooler, chill packs, an inner box that contains the FluMist sprayer and instructions for use found in the prescribing information, an outer shipping box that it's shipped in. Open the outer box. Remove the unpacking directions and the pre-labeled return envelope. Inside that envelope is a bubble wrap envelope, disposal guidance sheet, and absorbent pad. Save these for later. Then remove the cooler lid and chill packs to locate the inner box. Before storing or using FluMist, make sure you've downloaded the TiveTag app using the QR code provided in the unboxing directions. Then, tap the TiveTag on the outside of the inner box with your smartphone to ensure it has maintained its appropriate temperature range during the shipping and delivery process. A checkmark indicates that FluMist is at the right temperature, while an X indicates that it should not be used. If you're not going to administer your FluMist right away, it's important to keep it cold. Make sure you keep FluMist in its product carton to protect it from light. Store it in your refrigerator between 35 and 46 degrees Fahrenheit. Do not freeze FluMist or expose it to temperatures greater than 77 degrees Fahrenheit. You can keep your FluMist carton in the refrigerator until you're ready to use it. FluMist Administration. Taking FluMist or administering it to someone else is simple. Quick pro tip: keep the instructions for use handy for help throughout the process. Do not use FluMist if it has been frozen, dropped, or damaged, or the carton has been opened, damaged, or appears tampered with, or if the expiration date has passed. Use FluMist within 12 hours of removing it from the refrigerator. Start by taking the FluMist carton from the fridge and place it on a clean, flat surface. Open the carton and remove the sprayer by holding on to the sprayer body. Do not hold the sprayer by any other part. Check the sprayer to confirm the expiration date and the liquid in the sprayer. The liquid should be colorless to pale yellow and clear to slightly cloudy. Do not use if the liquid appears discolored. Do not attempt to remove bubbles from the sprayer. Then remove the gray rubber cap. Do not yet remove the clear dose divider clip at the other end of the sprayer. Make sure you're in an upright position and place the tip just inside one nostril to ensure the vaccine is delivered into the nose. With a single motion, press the plunger as rapidly as possible until the dose divider clip prevents you from going further. Then pinch and remove the clear dose divider clip from the plunger. Still keeping your head in an upright position, place the tip just inside the other nostril, and repeat just like the first side. When you're done, wipe away any liquid that drips from your nose. It's normal to experience some dripping or sneezing. Administering FluMist to someone else is just like giving it to yourself. Adults 18 years or older can give FluMist to others who are eligible to receive FluMist. Just follow the same simple steps. Remove the gray rubber cap. Do not yet remove the clear dose divider clip at the other end of the sprayer. Make sure they're in an upright position and place the tip just inside one nostril to ensure the vaccine is delivered into the nose. With a single motion, press the plunger as rapidly as possible until the dose divider clip prevents you from going further. Then, pinch and remove the clear dose divider clip from the plunger. Still keeping them in an upright position, place the tip just inside the other nostril, and again, press the plunger to deliver the remaining vaccine. When you're done, wipe away any liquid that drips from their nose. It's normal to experience some dripping or sneezing. Disposing of FluMist sprayers and packaging. Here's how to return your used sprayers and dispose of the packaging when you're done. Let's start with the sprayers. FluMist uses a return program to ensure appropriate disposal of sprayers. To return your sprayers, find the pre-labeled return envelope that came in your FluMist shipment. Remove the bubble wrap envelope and disposal guidance sheet. Set these aside and keep them for later. Leave the absorbent pad inside. Place your FluMist sprayers inside the bubble wrap and seal it. Now place the sealed bubble wrap inside your pre-labeled return envelope. After sealing, it's ready to be shipped out. If possible, please recycle all paper components of your shipment. The chill packs can be reused by saving them in the freezer or can be recycled as plastic after emptying the water contents. The foam cooler and cooler lid can either be recycled according to your local regulations or thrown into the household trash. Goodbye waiting in line for a flu vaccine. FluMist Home is flu protection done different, delivered to your door. Please continue watching until the end of the video for important safety information about FluMist.
FluMist is a vaccine that is sprayed into the nose to help protect against influenza in people ages 2 through 49 years. FluMist may not prevent influenza in everyone who gets vaccinated. You should not get FluMist if you have a severe allergy to its components, eggs, or other flu vaccines, or are 2 through 17 years old and take aspirin or medicines containing aspirin. Children or adolescents should not be given aspirin for 4 weeks after getting FluMist, unless your healthcare provider tells you otherwise. Children under 2 years old have an increased risk of wheezing, difficulty with breathing, after getting FluMist. Before getting FluMist, tell your healthcare provider about all your medical conditions, including if you are currently wheezing, have a history of wheezing and are under 5 years of age, have asthma, have had Guillain-Barré syndrome, severe muscle weakness, have a weakened immune system or live with someone who has a severely weakened immune system, have problems with your heart, kidneys, or lungs, have diabetes, are pregnant or nursing, or are taking antiviral drugs for the treatment of influenza. FluMist may cause rare but serious side effects, including allergic reactions. Seek medical help right away if you experience any allergic reactions, including hives, swelling of the face, lips, eyes, tongue, or throat tightness, or trouble breathing. The most common side effects are runny or stuffy nose, sore throat, and fever over 100 degrees Fahrenheit. Visit FluMist.com for more information.